Hello everyone. In this presentation, we shall see in detail about root canal irrigation. Apart from concentrating on the type of the irrigant solution that we commonly use for irrigation, in this presentation, I will concentrate more on the type of the syringe, the type of the needle, the gauge of the needle, and the irrigation procedure which is used for doing root canal irrigation. I am Dr. Benin Palayan, and if you are a dentist or dental student, kindly subscribe to my YouTube channel, Smart Dentistry. And if you want to join in any of my upcoming free webinars, online courses or hands-on courses, kindly scan on the code and follow me on Instagram. And if you are a beginner starting with rubber dam in your clinical practice, enroll for this program in Udemy. I hope that it will be really helpful. I will add a link in the description. So let's take a look at this picture for a second. There are different color-coded needles are over here. Just fix your mind in one of the needle which you use in your clinical practice for doing root canal irrigation. Hope you have made up your mind. Now let's see the exact sizes of these needles. The blue color ones are 23 and the different color codings you can see, and the yellow color ones are the 30 gauge needle. So the 30 gauge needle have a diameter of 0.31 millimeter. In the coming section, I am going to explain the most important point that I want to stress in this presentation. Just have a look at this presentation in this slide, and you can see that the left side here I have made the scale or the measurement, and then you can see the gauge of the needle like the 30 gauge, the 27 gauge and the 24 gauge. And then in the top portion you can see that I have just put what type of the preparation that supposedly the canals are prepared for. For example, the first one is prepared for 15 size and 2% taper, and if you are using a 30 gauge needle, that will penetrate inside the root canal maybe around 7 to 8 millimeter short from the tip. This green zone that you can see, that any needle that you are going to use for root canal irrigation should reach within the apical 2 millimeter of the root canal. If the needle is not reaching the apical 2 millimeter of the root canal, your irrigation is not going to be effective. Whatever the root canal irrigant solution that you are going to use, it may be sodium hypochlorite, chlorhexidine or whatever it may be, if the irrigant solution is not delivered 2 millimeter or at least 2 millimeter from the apical extent of the root canal, your irrigation procedure is not effective. So if you are using a preparation, for example 32%, and then only your needle will be penetrating or reaching to the apical extent. In the same way, you can see that if you are using the same preparations and if you are using a 27 gauge needle, even if you are enlarging the canal to 32%, your irrigating needle will not be reaching the required depth of penetration. And if you are using 24 gauge needle, I added this 24 gauge needle because I have come across people using this 24 gauge needle for local anesthesia and also for root canal irrigation. Then if you have enlarged the canal to 32%, the needle will stay at least 10 to 15 millimeters short of the canal length. So if you are looking into in depth of this picture, you will understand that the only needle that will reach the apical extent if you are doing irrigation is a 30 gauge needle. That's for 2% preparation, maybe the hand files. Now let's have a look at the 4% canal preparations. Here we can see the 4% canal preparations, and if you are using a 30 gauge needle, then you can find that a 25% or a 34% preparation, the needle will reach the apical extent, that is within the apical 2 millimeters. None other, the 15.4% or the most commonly used the 17.4%, even a 30 gauge needle will not reach the apical length. Similarly, if you are using the same type of preparation and if you are using a 27 gauge needle, it will not reach the apical extent. Maybe the 34% preparation, you can see that it going almost close to the apical end. And if you are using a 24 gauge needle, and it will stop maybe around 7 to 8 millimeters short of the root tip. So the only needle again which will go up to the apical end, even if you are doing 34% preparation, is a 30 gauge needle. Now let's see about the 6% preparation. Again, if you are doing a preparation with the 15, 6%, 20 or 25 or 36%, and if you are using 30 gauge needle, then you can see that the 25 6%, maybe the 26% and 36%, the 30 gauge needle will reach the tip, and none other the 27 gauge or 24 gauge needle will go up to the apical extent, however big your preparation is. So one point which I want to make sure and make clear with this is that for doing root canal irrigation, you should use only a 30 gauge needle. Just look at the yellow color coding of the needle, and any needle other than that, it is not efficient in reaching the root canal to the full extent, however big your preparation is. So from now onwards, I hope that whatever the situation is, you are going to use a yellow color coded needle or a 30 gauge needle for your root canal irrigation. Okay, now there are different types of needles which are available. We will see that most of the root canals are curved, especially the premolars and molars. They will always have a curvature, and if you are using the same needle which is used for local anesthesia, it will make a contact at some portion of the curvature, and it will make a stop at the curvature. A needle which is having a sharp tip will never go up to the root canal tip. So even though if the needle may be a 30 gauge needle, still if it is a sharp ended needle, then it will not reach to the full length. So this type of needle should never be used for root canal irrigation. And also, if you are using this type of open ended injection needles for root canal irrigation, the end is open. So any irrigation that you are doing, there are high chances the irrigating solution will go beyond the apex and get accumulated in the root canal tip, that is in the periapical region. So this may be one of the common reason that pain after cleaning and shaping may be because of the sodium hypochlorite entering through the apical foramen to the apical region. So again, this type of needle have to be avoided. Instead, you have to use a safe ended needle. So in a safe ended needle, whenever we are doing irrigation, the chances for the irrigating solution going beyond the apex is limited, and there are good chances that the solution will exit through the access cavity. Now let's have a look at the plastic type of the needle. This is a reflex irrigation needle, or the plastic or polyethylene fiber needles. So they have a 4% taper, and they are double vended or double side vended close ended needle, and always you have to use a syringe with a lever lock tip. The friction lock type, the needle may get popped up while doing root canal irrigation, so always use a syringe which has a lever lock mechanism. And I also prefer to use a syringe which is 2 to 3 millimeter, because Whenever we are doing irrigation, the chances that we are applying excessive pressure in the piston will be very, very less. If you are using a bigger size syringe, the chances for giving excessive pressure are more. Or you can always, so it is better to use a 2 to 3 ml syringes of your choice. Also, you can use the side vented, the 30 gauge metallic needles. So I prefer the metallic needles over the plastic needles because they are quite flexible and they are of small size and they come straight, and it is always preferable that we have to make a bend. But whenever we are making a bend, we should never make it at the hub, the place where the hub and the metal meets. No, we should never make a bend over there. Maybe around 60-degree bend that you have to make. We can leave around 3 to 4 millimeter, then you can make a bend. Most of these needles are 30 millimeter in length, and maybe you can get around 24-25 millimeter of effective depth of penetration. So because of the flexibility and the smaller size and no taper design, I prefer the metallic needles also. The plastic needles are also quite good. They have a 4% taper and they are of mostly bulkier, and they have a 4% taper, means that occupy most of the canal. Again, it's your choice. So my personal choice is that we can go for a metallic 30 gauge yellow hub needle. Next, the most important point that we have to understand is the volume of the root canal irrigant that you are going to use. I have seen many people using that root canal irrigating solution like an elixir, like taking 1 or 2 drops, just putting inside the root canal and expecting it have to have some magical properties and destroy all the microorganisms which are present inside the canal. No, that is not going to happen. The recommended volume is 10 to 20 ml of irrigant solution for each root canal. Remember and understand that it's not for each tooth. For each root canal, for a maxillary molar, if it has 3 root canals, we have to use 30 to 60 ml of the irrigant solution. So just understand that the volume of the irrigating solution is more important than the type of the irrigating solution. That's the entire theme of doing this presentation. So the volume and the delivery of the irrigant solution in the apical tip are more important than using whatever the irrigating solution that you are using, maybe sodium hypochlorite, maybe EDTA, maybe chlorohexidine, whatever the irrigating solution, if it has not delivered at the proper depth of the root canal, it is useless. So always make attention for an adequate penetration of the irrigating needle. So then the duration of the irrigation is, the recommended time for each canal is at least 4 minutes. The irrigating solution have to be there inside the root canal in contact. Now let's see what's the ideal technique for doing an irrigation. So this we can consider as a root canal. First we have to use a side vended needle, a single side vended or a double side vended needle that you can use, not the needle which is used for injection. It should have a closed end. After that, slowly with the help of a 2 to 3 ml, some small syringe, we have to inject the irrigating solution without any pressure. So what happens is, then there will be a slow delivery of the irrigating solution, and it should not be kept in a stable position. At the same time, the needle have to be pulled and pushed at a constant speed so that there will be an effective irrigation. So keep it in mind, a closed-ended needle with a side vent and a low pressure. We should not ever have a positive pressure for irrigation, and the needle have to be pushed and pulled in a constant speed. So that will provide an efficient root canal irrigation. So there is an easy procedure which is called the manual dynamic agitation, which is really helpful whenever you are not using any activation. So the root canal irrigant can be activated with the help of ultrasonics like endo activator or any other activation systems. But if you are not using that, you can use this highly effective technique. After doing cleaning and shaping, you have to fill the canal with an irrigating solution, especially sodium hypochlorite, and after that take a well-fitting master cone and in a stroke of 3 to 4 millimeter at a speed of around 100 strokes per minute, you have to take it out and push it inside. If you are doing that, the root canal will have a better cleaning ability. So that's because of the root canal irrigant can penetrate deep inside the root canals and also the lateral canals or the dentinal tubules, and it can have a movement of the irrigating solution inside the root canal. And also if there are some air bubbles which gets entrapped, there will be no activity of the irrigating solution happening. So this technique will remove those air bubbles also. So we all know that any root canal irrigating solution, we expect 4 things to happen. 1, it should have antibacterial property, it should remove the smear layer, and it should have a lubrication action, and also it should have a tissue dissolution. If you are looking for any one of the solution which possess all these properties, no, there is no universal solution which can bring forward all the required property of a root canal irrigating solution. So commonly we use sodium hypochlorite, which is a good antibacterial agent and a lubricant agent. Chlorhexidine, which has a extremely high antibacterial activity, again E. faecalis. So I always recommend to use chlorhexidine, especially in cases of doing retreatment. EDTA is a good lubricant. Always try to understand that EDTA comes as a liquid. That is what used for root canal irrigation. The EDTA, which is coming as a lubricant, is not an irrigating solution. EDTA coming with urea peroxide or something. So that's for canal negotiation and for canal enlargement and not for irrigation. So the EDTA solution have to be used, and the saline, yes, the most commonly used irrigating solution. So in this table you can see that sodium hypochlorite has a good antibacterial activity, lubrication and tissue dissolution ability, but it don't have a smear layer removal ability. EDTA has a smear layer removal and lubrication activity, but it don't have an antibacterial and tissue dissolution activity. Chlorhexidine has a highly effective antibacterial activity against E. faecalis, and saline, it don't have any good properties of an irrigant, but it can be used in between these irrigating solutions. So what irrigating solution that you are going to use? So shall we combine this 2 of these irrigating solution like sodium hypochlorite and EDTA and use? So there are a lot of interactions which could happen. So if you are combining sodium hypochlorite with EDTA, the tissue dissolving capability of sodium hypochlorite will decrease. So there will be no free chlorine which will be available from sodium hypochlorite for antibacterial activity. So that is not, we do not recommend sodium hypochlorite to be mixed with EDTA. So if you want to use EDTA after sodium hypochlorite, in between we have to wash thoroughly with saline, then you can use EDTA. In the same time, if you are combining sodium hypochlorite with chlorhexidine, a brown precipitate containing parachloroaniline, which can block the dentinal tubules, and it's very, very difficult to remove. So at any cost, sodium hypochlorite should never be combined with chlorhexidine. Again, if you want to use sodium hypochlorite, rinse it well with normal saline, then you can use chlorhexidine. So in the same way, if you are using EDTA and chlorhexidine solution do not react chemically, but it forms an insoluble salt that will appear as a white precipitate. So again, it is very difficult to remove. So in short, so do not combine any of the 2 irrigating solution. Whatever the irrigating solution you want to combine, you want to use in a sequence, in between you have to use normal saline, so that only there will be no interaction between these irrigating solution. So what should be the solution that we have to use in the end, that is the last irrigating solution? I would recommend that we can use sodium hypochlorite. Then you can dry the canal and you can do the obturation. So in fact, if you are not using sodium hypochlorite, you can use chlorhexidine as a irrigating solution, as a final irrigating solution in cases of root canal retreatment cases. So I hope this presentation would have given little insight about the technique of root canal irrigation, the type of the needle, the gauge, and the importance of the penetration of the irrigating needle till the apical extent in order to bring an effective root canal irrigation. So irrigation is very, very essential for a success of root canal treatment. So do a proper irrigation, choose a proper syringe, use a proper needle, especially use a needle which is 30 gauge. Any needle size, the gauge number lesser than that, like a 26, 27, 24, 23, none of these irrigating needles are good for efficient root canal irrigation. So thanks for watching, and I will come up with another presentation soon. Have a nice day. Thank you.